and welcome into basically getting help from Uncle Sam. We have actually Dr. Kylle McKinney here with us today, and we've had him on before, and it's really wonderful because you are the top person here to talk to about Social Security.
Yes, thank you for having me. I'm always glad to be on the show.
Well, we just love having you, and our audience is generally speaking 50 and older, so we're talking about people who are going to be looking at Social Security, and those of us who it's a very, very important part of our financial well-being.
Absolutely.
And there have been some changes recently, and let's inform our folks as to what exactly is changing, what they need to be looking out for.
Okay, well, great. I'll start off with the fact that this year has lended about 60 million beneficiaries a cost of living adjustment, the biggest we've had in 41 years, 8.7%. So that's equivalent to about $140 more in benefits per month that a person is looking at as far as their benefits are concerned. As a matter of fact, for those who are getting retirement benefits, the average monthly retirement check for this year, 2023, is now $1,827. That's the average that we're paying a month. The maximum that a person can receive for retirement is this year $3,627 a month. So again, those are the averages. Another thing to consider also is when people draw retirement before their full retirement age and continue to work, they're under what's called an annual earnings limit.
Okay.
And that has gone up as well for the year 2023.
That's good.
Yes.
That's good.
And that amount for this year is $21,240 annually. $21,240 annually. Of course, for every $2 over that amount, we're going to hold back $1 in benefits. Now, in the year that a person reaches their full retirement age, in that year, they can make a little bit more. And for this year, 2023, that's gone up to the amount of $56,520. $56,520. That's in the year that they're reaching their full retirement age. For every $3 over that amount, we hold back $1 in benefits. Now, what I'm talking about here, the annual earnings limit, is only up until the month they reach their full retirement age. The month they reach their full retirement age, this limit goes away. In other words, they can make as much as they want in earnings, and it will not affect their benefits. I also want to point out this is an earnings test. It has nothing to do with pensions, investments, or anything of that nature.
Okay.
Yeah, strictly earnings for those who file before their full retirement age and continue to work. With regards to Medicare, the Medicare premiums for Part B have gone down. You know, last year it was $170.10 per month that comes out of your Social Security check. Now this year it's gone down to $164.90. So it's about a $6 or $6 drop. So that's a little bit more money in some folks' pockets, but that's something to consider. Again, Medicare Part B is the outpatient doctor portion of Medicare.
Okay.
And again, that premium normally comes out of your Social Security check if you're drawing Social Security. If you're not yet on Social Security, you're going to be direct billed on a quarterly basis until you start drawing. So you'll just take that $164.90 times 3, and that will be your quarterly billing for Medicare until you start drawing Social Security. Then, of course, it converts to a monthly amount taken out of your Social Security check. So those are so many other changes, but that's for the most part the highlights of some of the changes for the year 2023 that I want to talk about.
So you're getting a little bit of a break, which is nice, you know, and I mean, anything that doesn't go up is good because everything else is going up.
Absolutely, absolutely.
So,
yes.
And we might remind people that you should, when you're drawing Medicare, you could be on Medicare at 65, but not have reached your full retirement age for Social Security.
That is correct. The full retirement age is actually 67 years old, and is based upon the year of birth. So, like for instance, anyone born between 1943 and 1954. Their full retirement age is actually 66. And then incrementally it goes up, from 1954 to 1960, by a certain amount of months. But at 1960 and later, the full retirement age is now 67 years old.
Okay.
So very well, people can draw, Medicare and not yet be at their retirement age. So now the only thing about that is they have to make sure that if they're not working at 65 years old, and don't have group health coverage or on their spouse's group health coverage, they must file for Medicare at 65 years old, Part B, under the initial enrollment, which is 7 months around their 65th birthday. So 3 months before, the month of, up to 3 months after. If they don't do so, they'll be subject to the general enrollment, which we're in right now, which is January through March of a particular year. and of course entitlement beginning the month after they file. But that enrollment in general carries a penalty with it, and that penalty is 10% per year for each year they should have enrolled and chose not to do so. So I always ask the people at 65 check with their HR department, or just contact either Social Security or the Area on Aging. And they can also assist in guiding people on what to do at 65 years old with Medicare.
That's nice to know. So your HR person or your insurance people.
Yeah, the Area on Aging, they have what are called state health insurance program coordinators, and you can just dial 1-800-AGE line. Yeah, and then they can get you to the county that you live in, and they can guide you as far as decisions at 65 with Medicare. Or you can call your local Social Security office. Our office 800-772-1213.
Okay, great. And then you had one other thing you really wanted to get across, and that was fraud.
Yes, unfortunately, fraud, Social Security scams are still on the rise, and I just want to make sure that the public is, keenly aware of what's going on. People are getting calls, seniors in particular, from people that are scamming them in their Social Security, purporting to be from Social Security. And I always say that, first of all, Social Security will never call you threatening you. We won't call you threatening you with, jail time or demanding immediate payments. We won't contact you, requesting secrecy, that you don't tell anybody what we're talking about, things like that. We don't also call you promising an increase in your benefits. We don't call you, asking you to pay us via debit cards or retail gift cards or cryptocurrency, things of that nature. I mean, these are the common things that are happening right now. And, if you are uncertain about us, if you're uncertain about it being Social Security, first line of defense is hang up the phone. Second line of defense, get the number whoever's calling you and call back to see if that's actually Social Security, or just call the Social Security office to make sure that we're actually trying to call you, because we do call individuals if there's ongoing business with them. And also another point too, we will never call you asking for your Social Security number. We already have it. So there's no reason to have someone from Social Security ask for your number. So if these things are happening, hang up the phone, and also contact our Office of Inspector General, ssa.gov/OIG, and they can do an investigation into what's happening as far as fraud.
Well, thank you very much. Don't you give out your Social Security number to
Absolutely.
No.
Absolutely.
So, Kylle, thank you so much for coming in. There's so much in Social Security. They're there to help you.
Absolutely.
And you've earned all of those benefits. They're not entitlements. You paid into them, so you pay attention to them. And thank you so much for being with us, and we'll be right back.